Hey everyone, and welcome back. Today we're going to be taking a deep dive into something pretty crucial, mechanical ventilation. You know, when you hear about someone being put on a ventilator in the hospital, well, today we're going to be figuring out exactly when and why that happens.
Yeah, it's certainly a vital piece of equipment, and understanding its purpose can really help you appreciate the life-saving role that it plays.
For sure. I mean, I always just kind of assumed it was for people who just couldn't breathe at all, you know. But the research we have here suggests it's a lot more nuanced than that. Ready to unpack all of this with me?
Absolutely. Let's break it down.
Okay, so first things first. What exactly is mechanical ventilation?
Well, in the simplest terms, it's a machine that helps a person breathe when their body just can't do it effectively on its own.
So it's like an external set of lungs, kind of.
Yeah, that's actually a great way to put it. It takes over the work of breathing, which is really pretty amazing when you think about it.
Yeah, it really is.
Yeah.
Now, our sources point to four main reasons why someone might need mechanical ventilation. Where should we start?
Let's start with the most common one. Acute ventilatory failure.
Acute ventilatory failure.
Yeah.
That sounds pretty intense. What exactly is happening in that situation?
So basically, it means your body can't efficiently remove carbon dioxide from the blood, which is a waste product of breathing. And this leads to a buildup of CO2 in the blood, which is where things get dangerous.
Okay, so how does a ventilator actually help in that situation?
All right, so think of your chest as like a pump, right? It's moving air in and out. So when that pump fails, the ventilator acts like a backup system, helping to remove that excess CO2 and keep everything balanced.
Oh, okay. Like a mechanical assist for your breathing.
Exactly. And it's crucial to catch this early, which is where impending ventilatory failure comes in.
Impending ventilatory failure, so like being on the verge of needing a ventilator.
Exactly. Doctors will look for signs that someone's heading towards acute failure, like a really rapid breathing rate or a really labored breathing pattern.
So it's all about recognizing those warning signs and intervening before things get really serious.
You got it. And sometimes this early intervention means actually using a ventilator proactively. It's called prophylactic ventilatory support.
Prophylactic. So like a preventative measure.
Precisely. It's used in high-risk situations like during major surgeries or after a severe head injury where there's a good chance that someone's breathing could become compromised.
Wow, I never thought of it that way. It's like a safety net for your lungs.
You could say that, yeah. Now, another major reason that someone might need a ventilator is severe hypoxemia. Have you ever heard of that?
Hypoxemia? No, not really. What is that?
It's essentially when your blood oxygen levels get dangerously low. We all know that we need oxygen to survive, but when those levels dip too low, a ventilator can step in to provide that oxygen that's so desperately needed.
Ah, okay. So like a backup oxygen tank for your body.
Exactly. The ventilator helps ensure your body gets the oxygen that it needs to function, even if the lungs themselves are struggling.
This is all making so much more sense to me now. So we've got these four main reasons: acute failure, impending failure, prophylactic support, and severe hypoxemia. Let's go back to acute ventilatory failure for a second. You mentioned the chest acting like a pump, and that when that pump fails, things go south. So what exactly causes that pump to fail in the first place?
Well, there are actually three main ways that ventilatory pump can falter. One is simply inadequate muscle function. Imagine trying to inflate a balloon with a hole in it. No matter how hard you try, you just can't get enough air in.
Oh, I see. So like the muscles responsible for breathing just aren't strong enough to do their job.
Exactly. It could be due to a condition like muscular dystrophy or even paralysis.
Okay, that's one way. What else can cause the pump to fail?
Another culprit is what's called excessive ventilatory load. Think about trying to pump up a bike tire that's already full of air. Conditions like severe pneumonia or a really bad asthma attack can create this kind of extra load, making it incredibly difficult for the lungs to work effectively.
Ah, so the muscles are working overtime, but they're just struggling to keep up with the demand. That makes sense. What's that third way that you mentioned?
The third way is when the central ventilatory drive gets compromised. It's like the conductor of an orchestra just suddenly falling asleep mid-performance. Conditions like drug overdoses or brain injuries can disrupt the signals that are going from the brain to the lungs, telling them to essentially take a break when they shouldn't be.
Wow, so it's not just about the lungs themselves, but also the signals controlling them.
You got it. And it's important to note that there's a difference between acute and chronic ventilatory failure.
Okay, so what's the distinction between those two?
Well, acute ventilatory failure is sudden. It's like a shock to the system. Chronic, on the other hand, develops gradually over time. And that actually gives the body time to adapt in a way, but that adaptation isn't perfect, and it ultimately leads to its own set of problems.
So it's like the body is trying to work around the issue, but it can only do so much.
Exactly, and sometimes you even see a combination of both. It's called acute on chronic failure. And this is when someone with a chronic condition like COPD experiences a sudden worsening of their symptoms.
Oh, wow. So their body is already working overtime and then things get even tougher.
Precisely. And it's really important for doctors to be able to understand these different types of ventilatory failure so they can tailor the treatment plans effectively.
Okay, yeah, I'm following you.
Yeah.
So we've covered those 4 main reasons for ventilation, and we took a little bit of a deep dive into acute ventilatory failure. What should we explore next?
Let's unpack hypoxemia in a little more detail, shall we?
All right, sounds good to me. Lead the way.
Hypoxemia is a lot more complex than it might seem at first glance. You see, it's not just one simple problem. There are actually multiple mechanisms that can lead to low blood oxygen levels.
Oh, okay. So it's not a one-size-fits-all kind of situation.
Not at all. There are a lot of different pathways that can all lead to the same outcome. And our sources highlighted 3 common culprits. Ready to dig in?
Absolutely. Let's do it.
All right, so let's tackle those 3 common culprits behind hypoxemia. First up, we have alveolar hypoventilation.
Alveolar hypoventilation. Okay, that's a mouthful. What's going on there?
So remember that whole analogy of the chest being like a pump?
Right.
Well, when that pump isn't working as efficiently as it should, it can actually lead to a buildup of carbon dioxide in the alveoli.
The alveoli, those are the tiny air sacs in our lungs?
Right, that's right. And they're where that magic of gas exchange actually takes place. You know, oxygen in, carbon dioxide out. But when there's not enough fresh air coming in, that carbon dioxide starts to hang around like an unwelcome guest.
So it's like stale air in the lungs is leading to those low oxygen levels.
Exactly. Now imagine a highway with multiple lanes, right?
Okay.
Some lanes are totally jammed while others are wide open. That's kind of what's happening in what's called a ventilation perfusion mismatch.
Ventilation perfusion mismatch. Okay, I think you're going to have to break that one down for me.
No problem. So ventilation refers to the airflow in the lungs, while perfusion is all about the blood flow. So in a perfect world, those 2 things would be totally in sync. But sometimes things get a little out of whack.
So some areas of the lungs might be getting plenty of air, but not enough blood flow to pick up the oxygen.
You got it. Or vice versa. It's like a supply and demand problem. You might have plenty of oxygen coming in, but if the blood isn't there to pick it up and transport it, it's not going to do much good.
Wow, that's a really clear way to explain it, thanks. Okay, so what's that 3rd common culprit for hypoxemia?
The 3rd one is called an intrapulmonary shunt. And this one's a bit more serious because it means that the blood is essentially bypassing the lungs altogether.
Wait, hold on. The blood is skipping the lungs completely. How's that even possible?
Well, it can happen in a couple of different ways. One way is through what's called a physiologic shunt. Imagine some of the blood vessels in the lungs are like detour signs on the highway, diverting blood flow away from the areas where gas exchange should be happening.
So the blood is taking a detour and missing out on that crucial oxygen pickup.
Exactly. And then there's what's called the anatomic shunt. And this is where there's an actual physical connection between the right and the left sides of the heart. And this allows deoxygenated blood to mix with the oxygenated blood.
Wow, that sounds like a pretty serious plumbing issue. So how do doctors figure out which one of these is causing the hypoxemia? It seems like they need a special tool to help pinpoint the issue.
You're right on the money. They use a measurement called the PaO2. Looks complicated, but it's basically just measuring the difference in oxygen pressure between the alveoli, which is represented by the A, and the arteries, represented by the A.
Okay, so a big difference means there's a big problem.
Pretty much. It helps doctors determine if there's a problem with the gas exchange happening, which could point to a ventilation perfusion mismatch or a shunt.
And this measurement is what helps them decide whether someone needs to be put on a ventilator.
It can, yeah, especially if that difference in pressure is really large, even when the patient is breathing in pure oxygen. It's like giving the lungs that extra boost and seeing if they can handle it, and if not, then a ventilator might be necessary.
I'm really starting to see how all these pieces fit together now. So we've covered those 3 common culprits behind hypoxemia. Thanks so much for breaking that down for me. It was super helpful.
My pleasure. It's pretty fascinating stuff, isn't it?
Yeah, it really is. It really highlights just how intricate our respiratory system really is.
You said it. And when those intricate mechanisms fail, well, that's when mechanical ventilation can truly be a lifesaver.
Speaking of which, I'm curious to learn more about the different ways that ventilation is actually used in practice. We've talked about those four main reasons, but what are the specific situations where a doctor would say, okay, this patient needs a ventilator now?
That's a great question, and it really all comes down to what are called the indications for mechanical ventilation, which basically act as guidelines for clinicians.
Guidelines, like a set of rules that help them make the best decision for each patient.
Exactly, and those guidelines are tailored to each of those reasons that we've been discussing. So let's start with acute ventilatory failure. Remember how we talked about that buildup of carbon dioxide in the blood?
Yeah, the whole chest pump analogy, right?
Right, so doctors use a measurement called the PaCO2 to actually check the level of carbon dioxide in the blood. And when that number gets too high, well, that's a major red flag.
So the PaCO2 is like a warning signal that something's not quite right.
You could say that if it goes above a certain threshold, it's a strong indication that the body is really struggling to get rid of that excess CO2.
And that's when a ventilator comes in to help out.
Exactly. It takes over the job of removing that CO2, giving the body a chance to recover and rebalance.
Okay, that makes sense for acute failure. But what about impending failure, where we're trying to catch things early? What kind of warning signs are doctors looking for in that situation?
You're right. Catching it early is key. Some of the key signs include a really rapid breathing rate, a labored breathing pattern, and even a fast heart rate.
So the body is basically in overdrive, trying to compensate for those breathing difficulties.
Exactly. It's like running a marathon. Eventually, you're going to hit a wall, and if those signs aren't addressed, they can quickly escalate into full-blown acute failure.
Got it. So it's all about recognizing those kind of subtle cues and intervening before it's too late. What about severe hypoxemia? What are the indications there?
Well, remember how we talked about the importance of oxygen levels in the blood? Doctors use a measurement called the PaO2 to check those levels.
PaO2, that sounds familiar.
It's kind of like the flip side of the PaCO2. While the PaO2 measures carbon dioxide, KO2 measures oxygen. When the PaO2 drops below a certain level, it's a really clear sign that the body just isn't getting enough oxygen.
So it's like a fuel gauge for the body's oxygen supply. When it hits empty, a ventilator needs to step in and refill the tank.
That's a perfect analogy. The ventilator essentially delivers that oxygen directly to the lungs, bypassing any of the obstacles that might be in the way. Now, what about prophylactic ventilation, that preventative measure we talked about earlier?
Yeah, when is that typically used?
So prophylactic ventilation is often used in situations where there's a really significant chance of breathing problems developing, like during major surgeries, after severe head injuries, or even when someone's in shock.
So it's like a preemptive strike to protect the lungs from any potential damage.
Exactly. And by supporting the breathing process right from the start, prophylactic ventilation can help to prevent complications down the road and improve the chances of a smooth recovery.
Wow, this all makes so much sense now. I feel like I'm finally understanding all the nuances of when a ventilator is really necessary.
It's a fascinating area of medicine, that's for sure, full of complex decisions and life-saving interventions.
It really is. So we've learned about those four main reasons for ventilation, explored the indications for each one, and even delved into the world of hypoxemia. What else is there left to uncover in this deep dive? We've covered so much in this deep dive, from different types of ventilatory failure to the complexities of hypoxemia. We even explored those really crucial indications for when a ventilator is needed. It's pretty amazing.
It really is. Mechanical ventilation is a super powerful tool in medicine, but it's not something to be taken lightly.
Yeah, that's a great point. It makes me wonder, are there ever times when using a ventilator might not actually be the best course of action, even if someone is having a lot of trouble breathing?
That's a really insightful question, and it brings up some really important ethical and medical considerations. While mechanical ventilation can be life-saving in a lot of situations, it's not without its risks and potential complications.
So it's not always a simple yes or no decision.
Exactly. There are a lot of factors that clinicians have to carefully weigh when making that decision. One of the biggest ones is the patient's own wishes and their goals of care.
So respecting the patient's autonomy and their right to make decisions about their own treatment.
Absolutely. If a patient has an advance directive that states their preferences for life-sustaining measures, those wishes need to be honored. It's all about making sure the patient's voice is heard and their values are respected.
That makes perfect sense. Are there any other factors that might come into play when deciding whether to use a ventilator or not?
Another key thing to think about is what's known as medical futility. It's a kind of complex concept, but it basically comes down to recognizing when further medical intervention is unlikely to actually provide any real benefit to the patient, or when the potential burdens of that treatment might outweigh the potential benefits.
So it's about ensuring that the treatment is truly in the patient's best interest and not just prolonging suffering.
Precisely. It's a really delicate balance, and it involves open communication between the medical team, the patient, and their loved ones. And in some cases, the focus might shift towards what's called palliative care. And this prioritizes comfort and quality of life over really aggressive interventions.
Yeah, it's a sensitive and complex issue, but it's so important to have those conversations and make sure we're considering all the different angles.
You're absolutely right. And there are even certain medical conditions where mechanical ventilation might be what we call contraindicated, meaning it's not recommended, and could even be potentially harmful.
Can you give us an example of that?
Sure. So one example would be in the case of an untreated pneumothorax, which is essentially a collapsed lung. Putting someone on a ventilator in that situation could actually make the problem worse.
Oh, I see. So it's not just about knowing when to use a ventilator, but also when to maybe hold back and address a different underlying issue first.
Exactly. It really highlights the need for really careful assessment and those individualized treatment plans. There's no one-size-fits-all approach in medicine.
All of this really underscores just how much goes into these decisions. It's not as simple as just hooking someone up to a machine.
You hit the nail on the head. It's a really multifaceted process that requires a deep understanding of both the science and the very human element of medicine.
Well, it's been so incredible learning about all of this. Before we wrap up this deep dive, I wanted to touch on something that came up as we were preparing for this episode. So we explored how mechanical ventilation supports breathing when things go wrong. But it got me thinking about the future. Do you think our growing knowledge of breathing could lead to new and maybe less invasive ways to help people breathe better?
Oh, that's such a fascinating question. Imagine if we could develop technologies that could assist breathing without needing those more invasive procedures. It would really be a game changer for so many people.
It would be incredible. Thinking about all the amazing advancements we've seen in medicine, it feels like anything is possible these days.
It really does. The ongoing research and innovation in respiratory care, it makes me feel really hopeful that we're on the verge of some truly groundbreaking discoveries.
Well, that's a hopeful note to end on. It's been an absolute pleasure exploring the world of mechanical ventilation with you. Thank you so much for sharing all your expertise and insights with us.
The pleasure was all mine. I hope that everyone listening has gained a deeper appreciation for just how complex breathing is and the really important role that mechanical ventilation plays in critical care.
I think it's safe to say we've all learned a lot from this deep dive. If anyone's interested in learning more, there are a ton of great resources out there. And remember, always reach out to your healthcare provider if you have any questions or concerns about your own respiratory health.
Great advice. Until next time, keep exploring, keep learning, and keep breathing easy.
Thanks for joining us on the Deep Dive.